It is. They both are.
I'm getting paid.
That's
Yeah, mine should be in the shot.
The whole table's in the shot.
Okay.
I'll put mine down as well. They're paying me to.
Right,
Alright.
exactly. Product placement.
Yeah.
So good afternoon, everyone, and welcome to Onslow Memorial Hospital's live event about COVID-19 and the Omicron variant. Thank you to Dr. Burlingham Deal and the Onslow Memorial Hospital executive team for sponsoring this event, and we are grateful to each of you for joining us today as members of our community. Our speakers today are our Chief Medical Officer and Senior Vice President, Dr. Stephen Spencer, and our Director of Pharmacy, Byron Lee. Please feel free to ask questions in the comment section, and we will take time at the end of our talk to answer them. I would now like to turn it over to Dr. Spencer and Byron Lee to discuss the Omicron variant.
Wonderful. So I think, as I've said before, one of the best things I get to do is to have these talks with Byron and get a chance to educate myself as well as the community about what's going on with COVID. Just to give you a quick state of the hospital, so we are certainly in the COVID surge. Our numbers are quite high. As of this weekend, we've had 50 patients who are COVID positive in the hospital, which is where we were in August and September during our Delta surge. Certainly, I think all of you are aware of the increased transmissibility of Omicron, and Byron will go into some details about that. And you may have also heard about it may be less virulent than the other variants, but certainly when you get really, really high numbers of cases in the community, you're going to get a small percentage of those cases that are going to be severe enough to land folks in the hospital. So that's where we're at. We continue to do a yeoman's job of making sure that we continue to provide essential services to our community for those who have COVID, as well as for those patients who don't have COVID. We have had issues with staffing. Of course, many of our staff people have gotten COVID or been exposed to people with COVID. But even with that, we've been able to maneuver our existing staff around, put together some protocols that have kept the hospital safe while we undergo this latest surge. So with that, I'm going to turn it to Byron to tell us, I think as an introduction, what happened between our Delta surge and our Omicron surge, when I think everyone for probably the 15th time had said, that was it. We're done. After this one, we're done. So
yeah.
What happened, Byron?
So the Delta, of course, as you know, was far more transmissible and in many cases created a disease state that was more readily progressive. In other words, it got worse quickly. It quickly became, because of this transmissibility, as we spoke in our last Facebook live event, it quickly became the dominant variant. It definitely had a huge impact on numbers hospitalized, numbers sick, et cetera, et cetera. So this Omicron variant, which, as you probably know from watching television, each of the variants, as they occur and become variants of concern, which are more, in other words, they have more potential to be problematic. The World Health Organization gives them a designation that is based on a Greek lettering system. So, we started with alpha, beta, gamma, delta, et cetera, et cetera.
Yes, we're all getting educated in the Greek lettering system.
Now we're up to Omicron. And the Omicron actually has more in common with the alpha variant than it does with the delta variant, in that its lineage is very clearly somewhat different than the delta variant. But it is, there are somewhere around 50 or so mutations that give Omicron a decided advantage in transmissibility. Things that Delta did in one particular way, Omicron does in a little bit different way. And it is very interesting to see how, as these variants develop, and of course we spoke before about how common it is for these variants to occur, because these viral replication processes, they don't have the kind of corrective mechanisms that say a human cell or even a dog or cat cell, whatever, true living organisms have corrective mechanisms within their cells to make sure that they're translated, their DNA and RNA products are translated appropriately. Viruses do not. They depend on the mechanism of the host cell, and because of that, they are very prone to mutations. Sometimes these mutations result in nothing. They result in things that are changes but really do nothing. Sometimes, however, they result in changes that make the virus more suitable to be passed on from one host to another. And of course, that's what viruses that's what they're essentially, their purpose is to be transmitted to another host and develop.
Like all things, they want to survive. They want to keep going.
That's exactly right. And we kind of personalize them and make it seem like they're planning, but in some ways it may absolutely seem that way. And again, they've become very efficient over time at doing what they do.
More like luck.
It kind of is, but the luck is being driven by certain factors. So taking a look at what happened with Omicron is it basically had the right kinds of mutations as a result of its process to really become way more easy to pass from one person to the next. There are two things that affected this. Number one, the mutations allowed it to bind in a different way. It binds more specifically and tighter. But there's another thing that may, again, as you kind of mentioned in your early discussion, may give us a little bit of a reprieve with Omicron. And that is that it is potentially less severe in its side effects. Now, that does not mean that it does not have side effects. That does not mean that it does not have symptoms. I should say symptoms more specifically. The symptoms can be very problematic. If you compare the symptoms, however, and say someone who was not vaccinated versus someone who was vaccinated, as a rule, between those two groups, an individual who is vaccinated will have fewer symptoms. Now, it's not necessarily because the vaccination is completely, obviously, is not protecting them from getting the virus, but it gives the body a certain degree of knowledge in dealing with the virus in more ways than just the superficial parts that allow the virus to transmit. There are parts that enable us to be able to fight it off more effectively, which is the kind of that underlying immune system that kind of goes a little bit deeper than just what we all hear about these spike proteins. Well, your immune system is a lot more complex than just recognizing a spike protein when you see it.
That's really a great point.
Absolutely.
I think if you can expand on that a little bit more, I think the lay folks are interested in this idea of the antibodies, which I think we focused a lot on in the beginning, versus this memory, which is actually, you even sort of describe it that way, as your body is sort of remembering that it saw something similar before.
That's exactly right. It's kind of like this. If you put out, let's say the police put out an APB and say there's a red Corvette driving down Western Boulevard, and it's full of this and that and the other, and folks that we need to, they've just robbed a bank or whatever. Well, you can recognize that red Corvette pretty easily. But I'm sure you've all seen the movies where they drive the red Corvette into the garage and repaint it very quickly, change the license plate, and now all of a sudden it's no longer a red Corvette driving down. So you're not finding what you're looking for right off the bat. But guess what? It's still a Corvette. So as your body recognizes, again, it may not be the virus that you thought you were ready to encounter, but there is a much greater part of your immune system, that memory immunity, that recognizes, hey, wait a minute, you're not fooling me. I do recognize you, and I'm going to call in the troops, so to speak, and say, hey, it's not a red Corvette, but everything else matches.
So you may not notice it immediately because it's not red, little bit more investigation.
That's exactly right.
So that speaks to the fact that you may get some breakthroughs with the Omicron.
That's exactly right. And again, this is a normal viral process. If anything, it is probably a sped up viral process in that viruses, oftentimes when they first develop, they are very virulent. In other words, they cause disease. You have, say, a virus like Ebola, which is still a very problematic virus. If you contract, you're bleeding from orifices, and it causes terrible, terrible things. But the bottom line is, the worse those symptoms are, the more likely we as human beings are to notice them and say, wait a minute, that person's coughing and hacking and they're bleeding and that's not something I want to get near. So by the process of time, viruses which produce milder symptoms are the ones that do better because they get passed along. Because if you don't know I've got it, well, you're likely to come in and talk to me and interact. Yeah, absolutely. Which again is why it's part of our whole masking and social distancing from the very beginning are kind of designed with that in mind. You may not recognize those symptoms as the virus gets milder, but we've come at this virus with probably one of the most concerted efforts of any virus in history, developing a vaccine in record time and coming at it in such a way that as you bring medications to treat various situations, antimicrobials in particular, the thing that you are treating develops changes that allow it to survive. And in this case, for viruses, and possibly, hopefully, eventually, for COVID, the COVID virus, it will develop in such a way that it becomes a mild, it may be, at some point, hopefully in the near future, our next common cold virus.
So that's going to be the end of our story, and I'm going to ask you to play prognosticator. Let me know what this looks like in 6 months or a year from now.
Yes.
But speaking to it, something I think that's been a bit controversial, but does have some scientific backing, is this idea of Omicron not only being less virulent, but also the infection and the length of the infection is different, and the length of time that you're infectious. Can you speak to that?
Sure.
How it's different than the other variants?
So in the past variants of Omicron, basically your symptoms were expected to develop somewhere in generally about the 5th or 6th day after exposure. You would be expected to potentially start seeing symptoms. Now again, that is still kind of early on, but generally by that time you're seeing something post-exposure. If you are going to demonstrate symptoms. With the Omicron variant, you're looking at a much shorter incubation phase, and that is the phase at which the virus gets in, it does its infection, it spreads throughout the body, and believe it or not, during that time, before you ever show any symptoms, that's the point where it's actually the most contagious. You have the most possibility because A, remember we talked about when you're not showing symptoms, people tend to get around you, but B, it's spreading throughout your system and being shed in mass quantities. So it can be passed along, again, before you ever know you have COVID, which is why it's so important, again, to keep talking about the hand washing and the mask and the social distancing. But yes, Omicron is a very quick sort of onset. It spreads very quickly because of that transmissibility and moves from cell to cell very quickly. And as a result of that, you start seeing symptoms quickly, and again, hopefully, you have a mild case and you're able to get over it more quickly than with the previous incarnations of COVID.
Which speaks to your idea, maybe it's morphing, some people say the flu and then maybe the common cold, which is quick. When we used to use those as differentiating factors, especially with the flu and
That's right.
COVID, we
That's
would
right.
say the flu is much quicker.
Yeah.
You feel bad for 2 or 3 days and then
Yes.
you're over it, as opposed to COVID.
Yes.
This new Omicron makes that differentiation a little bit more difficult.
It is a lot more difficult to kind of tell the difference because it is able to develop more quickly. And I will say that there is yet one more strain that we're currently aware of, the BA.2 strain called the stealth COVID, or sometimes they call it Omicron's little brother. But it is even, based again on the initial impressions, it is even more transmissible with another 20 or so mutations, but also even milder. So we're seeing a normal mutation process for the virus. It's happening very quickly, almost before our eyes for the virologists that are looking at these and understand those processes. It's happening in a very rapid way. And again, it's yes, it's more transmissible, but if it produces mild symptoms, it actually could work to our advantage. Now, go ahead.
I was going to go to vaccines, but go ahead, Jeff.
Well, I just wanted to say that sometimes we talk about mild symptoms and we make the mistake of thinking that, well, mild means mild, so it's not going to be a problem. Well, perhaps the better term is milder symptoms, because if there are underlying conditions that you're dealing with, let's say you have asthma, let's say that you have congestive heart failure, let's say that you have COPD or another disease state that puts you at risk. You know, on the best days, you still have difficulty going to the mailbox or whatever. If you toss COVID on top of that, even though the symptoms are milder than the original version, you may still have some very severe symptoms. Milder does not necessarily mean symptom-free. And combining that with underlying conditions means and believe it or not, the closer I get, the younger it seems to become. But anyone over the age of 65 is in a situation where diseases that come along are going to affect them more severely. Your immune system is just not quite what it used to be, and so it could be very problematic. And don't make the mistake, as you've seen some in the news saying, well, I want to get this thing. If it's going to be mild, I'll go ahead and get it, and then I'll be protected against it. Well, you know, hopefully if you do get it, you will end up having a milder form and survive it, because that certainly is what we all, you know, hope for. But don't make the mistake of thinking that it's going to be symptom-free and I'm just automatically, because it's Omicron, I'm gonna you know, cakewalk through this.
That's actually a really good point. I think we may have made a mistake a few weeks ago in saying mild, but now it's still, I mean, even if you don't end up in the hospital, lots of people are out for several days with really significant symptoms.
That's right.
So that's actually a very good point.
Yeah, absolutely. Absolutely.
So vaccines. So we've gone through progression. I think when the vaccines first came out and we heard the 95% efficacy numbers, and you know, even up until I think the summer before we had the big Delta surge, we sort of thought vaccines could potentially eradicate the virus.
Right.
So we would get herd immunity, there would be almost no transmission of the virus,
right,
because so many people would either be exposed or they would have the vaccinations. Now that is not the thinking, and I think we're focusing more on reduction of hospitalizations and severe illness than actually eradicating the illness. But speak to just what we're seeing in terms of the research and studies around vaccines and how they're responding to Omicron.
Absolutely. So bearing in mind that the vaccines were developed from a very specific code, RNA code, that was designed very early on in the process. It's kind of like we've already talked about the process of having the red Corvette versus the Corvette driving down the road. They were designed for the red Corvette. Now Omicron has turned into a gray Corvette. Now it's turned into a green Corvette. Now it's a little bit different. And that initial protection provided by the vaccine, while it does provide protection, the real and thinking about it truly, what our goal from the very beginning was, we were hoping for the best, but our goal has always been about reducing severe symptoms and reducing the possibility of hospitalization, because as we all know, there are areas in our own country and in other countries throughout the world where the hospitals, the healthcare system as a whole, is overwhelmed by the number of cases that are developing and continue to develop as this disease progresses. So our goal really at this point is let's just make sure we can reduce the number of people that are severely impacted or potentially the deaths caused due to COVID. And vaccines remain a very, very important way to do that. Just like as we talk about getting COVID, when you get COVID, of course your immune system kicks in, you get antibodies that develop and so on. But just like is the case naturally, whether you develop your own antibodies because you've had COVID or whether you get the vaccine, you're always best protected soon after you have gotten that surge in antibodies, soon after you've had that immune response. So if you are someone that has gotten COVID and you say, well, I had COVID, so I'm pretty much protected. COVID mutates very quickly. This is not one of those things where you necessarily, particularly if you are an individual with other conditions, other health conditions, you want to remain in a state where your antibodies are at a low level. Yes, you still have immune protection, but why not keep it at its level best? And that's the whole concept of boosters, whether it's getting COVID or if you've gone for a while since you've had COVID, it's been a few months, go ahead and get the next booster. Go ahead and get the first shot if you've not gotten the vaccine, because statistics have proven, studies have shown, very recently, good studies have shown that patients who have had COVID and get the vaccination do better than individuals who have had COVID and do not receive
super
vaccination.
protected.
They're like, their immune system is literally boosted in an incredible way. So again, every bit of protection you know what COVID was like when you had it the first time. Think about, do I want to go through that again? Well, let's try and make sure that the next time, if there is a next time, that we are as potentially protected as we can possibly be. And so that vaccination or booster shot is the key. About every 5 to 6 months, depending on which original vaccination you have, you should anticipate, at least while the disease is very prevalent, getting a booster shot to get your antibody levels up to where they need to be.
Yeah, so those antibodies will give you that immediate protection, reduce your risk of the breakthrough.
That's right.
Still get pretty good protection from the original 2-dose series for hospitalizations and severe illness.
Correct.
But again, that booster really helps.
That's
and
right.
As you said, even if you've had COVID, getting that booster after your initial infection is very helpful and also significant protection.
Yeah, absolutely. It's kind of like putting that coat of protectant on your back deck.
Correct.
If you miss a few years, guess what? Your deck's going to look like a mess, and you're going to have to end up replacing it, right?
Yes.
You want to make sure that you put that on there on a regular basis. It's the same thing. That antibody that developed as a result of the booster pumps things back up. It puts that new coat of paint on there or protects it on there so that the underlying wood is well protected and maintains its appropriate health. And it's kind of the same thing. You have to do that periodically, and this is one of those situations that benefits greatly from that kind of protection.
And I'll just add one other thing that I think you alluded to too is as the rates of transmission are really high, that also affects how much protection you get. So
Yes.
if our rates of transmission were really low and there's very little COVID in the community, then by design, you're much less likely to get COVID.
That's
and actually,
correct.
You'll be more protected if you have the vaccine or previous
That's
infection.
correct.
When they're this high, you want as much protection as possible.
Absolutely.
So that brings us to sort of the idea, you spoke to this a little bit, about boosters, every 6 months, every year. And the other issue is vaccine specific for the newer variants, specifically Delta and Omicron.
Yes. So with the studies that have looked at the use of boosters have demonstrated a very good correlation between regularly getting boosters, in other words, getting that booster. If you got, let's say originally a Pfizer vaccination, your booster should be about every 5 months. With Moderna, probably about that same frequency, every 5 or every 6 months. And then if you got the J&J vaccine pretty much 2 months after you got that original shot, you should probably consider start getting a booster about every 5 or so months, although 5 to 6 months depending on the availability in your area. But absolutely, studies demonstrate that having that booster on board keeps your antibodies at an appropriately high level. Bear in mind that the antibodies that are developed, again, because of the booster, are very specific to the spike protein. If the spike protein changes in certain ways, it makes it less recognizable. It changes that coat of paint, right? But it does not change the fact that there are many, many places on the spike protein that have not changed. There's about 5,000 or so individual bases in that particular spike protein. So there's plenty of it that's still the same and can be recognized. So even though the protection may not be as high as, say, it was against Delta or against the Alpha Beta variants, it's still very good protection, and again gives you a base level that is still very helpful to avoid ending up being severely sick or ending up in the hospital or even worse.
And what do you think about and specifically the Pfizer CEO has talked about ramping up production of a vaccine specific for Omicron? What are your thoughts about that, and if we're going to need that in the future for every variant that comes along?
Well, I think that there is a very good probability for a number of reasons, some of them financial, but assuming looking at it strictly for altruistic reasons, right now we have lots of folks that get the flu vaccine, right? We know that flu, just like, in other words, flu is probably one of those master disguise artists. It manages to change its cell coat. It manages to change its outer coat so rapidly that it is very difficult to keep up with. And so each year, the flu vaccine that you get is actually a culmination of a year's worth of research into what is the prevalent strain moving around right now, what does it look like. It's developed from 4 different particular strains of flu, alpha 2 beta. It is done on an annual basis to keep the vaccine as current as possible, thus give you the best protection. We're talking about with COVID, a virus that changes also very rapidly. We've seen that. And so does it make sense that we may possibly need an annual vaccine once we are able to get the COVID levels down to a low level? Yes, it's very possible. And does it make sense for that to be updated? It absolutely does. We do it right now with flu vaccine, and it gives it a better chance of protecting us. And again, depending on how long COVID remains out there and transmissible, will kind of depend on the time frame that we're looking at with regard to that. But again, these are very effective vaccines. Even as mutations occur, they're still very effective, but at a certain point, does it make sense to update them to have the latest strain, the thing that's really taking over and most common in it? Yes, absolutely. And I think that makes sense.
So as an extension of that question, you're going to again play prognosticator. So there have been some people optimistically who have said this is the beginning of the end. Although I think we've said that 15 times.
Yes.
But maybe this is the beginning of the end because it's now morphing, as you said earlier, into more of a flu-like or a cold. And so the pandemic is now becoming endemic.
That's right.
So one, do you agree with that's what's taking place right now? And two, what do you see for next fall or winter? What do you see 2 years from now? How do you think this pandemic endemic is going to look?
Yeah, I think again, in part because we have, brought so much scientific research and effort to bear against this particular virus. We're pushing it in very specific ways. Again, just like every other system in the universe, if you press this way, it's going to react. For every reaction, there's an equal and opposite reaction. That goes on back, right on back to physics. So we have pressed it in a very particular way, and for the most part, there are still two possible paths that can occur with any disease state, with any virus or bacteria or whatever. It can either pick a path and be driven into a path in such a way that the strains that develop are, as we're seeing, hopefully, are becoming less and less problematic in symptomology, so that they can be passed very easily from one person to another because you're not even aware that that person you're getting it from has it. Or they can become far worse, as we've seen with certain bacteria strains that we've used antibiotics and they've just figured out a way to get around the antibiotics because we're destroying them. In this case, what we're seeing is very promising. And while, again, no one can predict with 100% certainty, I will say that as we look at this, just as many of the experts have come to the conclusion, we may well be seeing the beginning of the end of COVID, because what we're seeing are new strains that are developing in a manner that makes them still very efficient at transmission, but very efficient also at hiding themselves because the symptoms are very mild. And once we reach that point, we may well be looking at vaccinations that only occur. Let's take, for example, something like polio. Okay, how often do you get polio vaccines? Well, do you know why you get them so rarely? You get them as a child, and then, you get them that rarely because there's not polio around every corner. It's been driven into a state where there are very, very few individuals in the population that have polio. And many of the cases nowadays that develop are less severe than the cases that developed and caused paralysis and more severe symptoms when the disease first started. So we've seen that already. It's just in a very accelerated process with COVID because our ability to respond very quickly is just ramped up at this point. And again, not to put any laurels on anyone's shoulder, but we've done very well at coming up with vaccines as quickly as we have. Certainly, we all wish that there were more things that we could do or come up with a cure. That would be great. But in the meantime, we've got folks that are addressing this on a hourly, day by day basis, constantly seeking ways to get in and figure out a better way. And because of that, if we see the declines that a lot of the areas that have had this latest Omicron surge, look at what's happening in those areas after that surge. You see a fairly rapid decline in COVID incidents.
South Africa, the United Kingdom.
Absolutely.
Even in the Northeast now we're seeing.
Yet some of those areas have actually literally done away with their need for social distancing, mask wearing, and those kinds of things, because the prevalence has dropped so rapidly. But again, that is what we normally expect with viruses, only normally it's over a much longer time span.
Right.
If we see, back to your original question, if we see those levels drop significantly enough, then we may be only looking at, like the flu, a seasonal vaccination as opposed to constantly having to be vigilant because everyone's got COVID and we're all trying to stay away from it.
Right.
Get those levels low enough, and who knows, we may end up with protection like we have from polio, a vaccine that's pretty effective. It protects you certainly from the hospitalization or severe illness, and again, there are few people out there with it, therefore your chances of encounter. So yeah, I absolutely think that we can reach that point, and I do believe that we're seeing that, the first beginnings of that right now. And let's hope that we see that develop as quickly as it appears to be moving. Let's hope.
Let's hope.
Yeah.
So I think I have two big questions left. And I'm going to start with actually masks. because there's been some information in the press, some information from the CDC about masks, and I think we could go through the long history from the beginning of masks and how we changed our view of them and how we use them. But I think the latest data requires a little bit of discussion.
Yeah, yeah. Well, a lot of the focus that you will find, you keep hearing a lot about the KN95 or N95 mask. The mask material is something that is very important because certainly the mask that most of us have easy access to, the inexpensive, what we call surgical mask or exam mask, depending on who you might have.
Isolation mask.
Isolation mask, yes. These masks are good at keeping, if I am infected, they're pretty decent at protecting me from you. Matter of fact, I have some lovely statistics here on the variations in mask wearing.
Yeah.
So if I'm wearing no mask at all, and you are wearing no mask at all, and I've got COVID, then basically within a 15-minute time frame, you are going to be exposed long enough to get COVID. If, however, you're wearing a cloth mask, and I'm wearing a cloth mask, then it's going to be about 27 minutes that we have to remain in contact. Now again, that's not much of an improvement, but still, it's an improvement. If we're wearing these surgical masks that we're wearing now, and both of us are wearing these masks, guess what? If we're both wearing these masks, then we can remain into contact for about an hour or so before we have to worry about transmitting. Now, most of us aren't sitting through an entire hour of Facebook Live.
Yeah, I was going to say this.
But at the same time, key to that is maintaining appropriate distance.
Mm-hmm.
But with a mask like an N95 or KN95 mask, and preferably one that has FDA acknowledgement, and you'll see a lot of the masks that are being advertised now that do have FDA acknowledgement of their status as a N95. If you and I are both wearing N95 masks, then we have to be in each other's presence for 25 hours.
That's a big difference.
To risk transmitting something to each other. So mask wearing is very important. Again, not just wearing masks, but the kind of mask you wear. Let's realize at a certain point, the cloth mask, without the use of one of these more specially formulated masks that provide that tighter weave and appropriate protection, the cloth masks are they provide minimal protection at best. But the KN95 will protect, even if you were not wearing a mask and were infected, and I had a KN95, I can still be around those individuals. And let's think about this in the context of going into a store or going out to eat or going to get groceries. Wearing that N95, I have 2.5 hours of protection in constant contact with an individual who has COVID with no mask at all. So the N95 is really doing a fairly decent job, assuming it's being fitted properly, and that means that it's a nice tight fit. You want to make sure that your nose is covered, that your mouth is covered, and the mask comes under your chin. Mm-hmm. And you want to make sure that you haven't got pockets on either side that you're, blowing air through. Some of you may have seen these masks that you can get. They look like almost some kind of tactical mask. They've got these little ventilation things down here. But guess what? If they've got the little ventilation things down here, you actually are doing a disservice to your fellow co-workers and so on, that you're wearing those little ventilations around, because even though they make it easier for you to breathe, they also make it easier for COVID to pass right on through. And again, the mask wearing, ideally, at the very minimum, we want to protect someone from anything that we might be transmitting. Correct. It may not be protecting me from you, but it needs to be protecting you from me if I'm the one with COVID. So if we're all wearing the mask, again, we talked about the timing. We've got pretty good protection if everyone's wearing the mask. But again, that N95 level with a good fit so that it's not gaped, and none of them fancy masks with the ventilators on them that are literally spewing everything right back out at everybody.
So think about that when you see somebody with one of those. Everything's spewing
Yeah,
out.
exactly right. Every time I see those, I'm like, well, I know you think you've got something that is fancy there, and you probably paid a pretty penny for that. But guess what? You're spreading that, whatever it is you might have.
Could be the common cold.
It could be the common cold. It could be the flu. Who knows what it might be? But you're still spreading it just as effectively. You might as well not be wearing a mask at that point, at least for the people around you.
And I think a little bit of the rationale, there's been some pushback about, we told people just to wear any mask. I think part of it is this increased transmissibility of Omicron, which makes it more important. And the flip side is that we want people to be comfortable in their masks. We don't want you to wear something that makes you uncomfortable because you're not going to wear it.
Right.
So if it means that the cloth mask is the only thing you feel comfortable in, then wear a cloth mask. But try out the surgical mask or the isolation mask.
Absolutely.
Try out a KN95. A lot of folks have been surprised that that actually felt more comfortable to them.
Yeah, it does. And sometimes the KN95s are designed in such a way that they are lifted for the most part off the face. So it can be a more comfortable experience in the KN95 or N95, as the case may be, because they are designed in such a way with certain rigid points that they are lifted off your face, and it may be actually more comfortable than even a lighter mask or what you perceive as a lighter mask, just because of the way that they are designed. And that, again, you can believe that there are people out there designing masks on a daily basis now to try and take advantage. Again, everything ends up being a financial opportunity, sadly, for everyone.
The most comfortable mask ever.
That's right. Most comfortable ever, most effective, FDA approval, et cetera, et cetera. So, expect it at the Amazon or supermarket near you, whatever the case may be. So, yeah, definitely.
Correct. So the last line of questioning is around our therapeutics, and I'm going to actually throw in a little PSA before we start that, which is around our emergency department. And of course, at Onslow Memorial Hospital, we care about our community. We take seriously the idea that we are the only community hospital in Onslow County. And so we want to make sure that we are open for our patients that need us for emergency situations. What we are not is a routine testing center. So, we certainly know that lots of folks are going to have symptoms that may be consistent with COVID. And if you feel that you do have those symptoms, certainly going to a testing center is appropriate. Or just quarantining at home with the idea that it could possibly be COVID, and stay at home, make sure that you're staying away from other people so you don't potentially spread it. The emergency department is for folks who have significant symptoms, so significant that you need acute treatment in the emergency room, or alternatively, if you think you need to be admitted to the hospital. Again, it's not a place for routine testing for COVID, and in fact, you want to stay out of areas where you could potentially infect other people. So it's in your best interest not to do that, and it's in the best interest of our other patients to not be exposed to people who potentially have COVID. So again, if you're having significant symptoms, you think you need acute treatment for COVID, the emergency room is the place for you. But if that's not the case, it's best if you stay at home. With that said, Byron is going to tell us about the options. So we have options for people who are having significant symptoms, and also people who, as you alluded to earlier, have increased likelihood of having severe COVID. So what are those new things on the horizon that we have to treat COVID now?
Well, Dr. Spencer, I want to tack on to your PSA too, that some of the folks that are going and being tested for COVID are, they give their information, they give their phone number, and they get a text and it says, you've got COVID, it's positive. And so sometimes when you get a text like that, and again, you don't have a healthcare provider that's talking you through this process, you may think, well, hey, I need to go to the hospital. I've got COVID. Again, as we pointed out, the symptoms of COVID are varied, and if your symptoms are mild, and they may be as mild as what you would normally experience with a cold, some light congestion, may not be, much of a problem for you to deal with at all. You don't need to go to an ED emergency department to be treated for something that, you would just be told to give, take just like you normally hear with a cold, give plenty of fluids and rest and that sort of thing. But just be mindful that if your symptoms are mild, continue to care for yourself, self-monitor and care for yourself as you normally would for any viral infection. But if they become severe enough, that's the point where you need to worry about coming in, because if you come into the emergency department, the concept is you should be coming in because you anticipate being treated for severe symptoms. There's no magic cure for COVID, unfortunately, and so what we would treat you with are things to treat your severe symptoms. But if you're not showing severe symptoms, guess what? There's not really much that you can do. Now, having said that, bear in mind that there are things that make you predisposed to having severe symptoms. So if you have COVID at all, or if you are in a situation where you've been exposed to COVID, or maybe you had a family get together and one of your nieces or nephews has said, no, I ended up with COVID, and now you are a 70-year-old individual who has asthma or who has other underlying conditions. You're worried, what if I've contacted it, or what if it could devastate me. I already have trouble just getting to my mailbox in the afternoons. What can I do? Well, there are some treatments that are available out there that are usually, in many cases, accessible from a number of different venues. We do have treatment facilities in our area that have what we call antibody treatments. Right now, there are some of the antibody treatments that we first came out with literally have at this point not shown themselves to be effective against Omicron, so they've been removed and replaced with others. There are antibody treatments that basically, again, these are antibodies that don't depend on your own immune system to develop. They are given to you directly as antibodies. So you get a big boost in antibodies. In most cases, it lasts for about 90 days of protection, and then again, it's just like as if you had, the vaccine and you've reached that 5-month mark or 6-month mark. You need another boost. So after that 90 days, definitely you would need another boost of antibodies. And then there's a treatment that is currently becoming more available. It is very low availability right now, but it's a combination of two antibodies that may end up, if the studies demonstrate themselves effectively, may end up lasting as much as a year's worth of protection. Right now, we know at least it provides a 6-month protection. But again, the currently available antibody product is called Sotrovimab. That's the one that lasts about 90 days, and that is available now from areas. Can I mention the name of one?
Sure.
In our area, StarMed does provide these infusions. There are neighboring clinics that do so, but these are things that are done on an outpatient basis. In other words, not something you would be admitted to the hospital to have done, but they are protective. The one that I was talking about that may last as long as a year is a product called Evu Shield, and not many places have this yet, but it is something that the government is gearing up and preparing to provide these facilities to be able to provide this protection. It is a very long-lasting product, this Evu Shield product, and it works in a very again, there are similar ways, but it works in a manner that's very debilitating to even the Omicron variety of COVID. So those are two options that are certainly available. There are also products now that are oral products that you could take, by mouth. They're pills. They're treatments that last 5 days. And we do have some pharmacies in our area that are getting those available. These are, again, not things that you would get in the hospital, but they're designed to keep you out of the hospital. A product called Molnupiravir, which is an antiviral product that is very effective. And then what may well be even more effective, there's a product called that is a combination these are some very interesting terminologies. Ritonavir and nirmatrelvir, which is a product called Paxlovid.
See, I always say Paxlovid.
Yeah,
I let Byron
Paxlovid.
do the
So sometimes I hesitate with the brand names, but this Paxlovid product is a combination of two ingredients, one of which basically keeps your body from breaking the other one down, and the main ingredient, which does not, surprisingly, does not have any effect on the spike protein. It is not dependent on the spike protein. It actually inhibits at the cellular level the protease that when the virus first releases its material into your cell, it has to be translated and then broken into two parts for the virus to be able to replicate itself. Well, this drug that we're talking about is a protease inhibitor. In other words, it keeps that viral protein from being separated into its two parts, and if it can't separate and recombine, it is not capable of replicating the virus. So it's a very effective medication. Again, it is a newer product that is just now only being released at a broader scale. But it may prove to be an even more effective methodology at stopping the virus early on, so that if you are potentially exposed, you have a protection level that goes beyond the spike protein and actually stops it in a way that may end up proving to be more effective. So those are definitely products that are out there. In addition, of course, vaccination is still one of your most effective means of protecting yourself. But there are other medications that are designed, and this long-term, the Evu Shield product, it's actually designed as a protective measure. So you don't have to have COVID to get it, but you do have to be someone that is likely, as we said, older or suffering from diabetes or another disease state that would put you in an extreme risk if you were to get COVID.
Yeah.
So it's a protective agent. Again, we've got these drugs in the arsenal. It continues to develop. We continue to do research. And these, like I said, these newer agents are proving themselves to be very effective.
And I think that's a great point that you said. Once again, those medications are really for people who are likely to progress to severe COVID.
Yes.
Again, not your relatively healthy younger person,
right,
who happens to get COVID. They'll most likely have mild symptoms. And again, we don't use the ER as the testing facility. And if you test positive, unless you're having significant symptoms, significant shortness of breath, or something that would need acute treatment, you should not come to the emergency department.
Right.
So this has, as usual, been amazing. I think I learned something. I listened to this stuff all day long. I talked to Byron and I learned more. So this is great. Sophia, do we have any questions for me?
So we did get a few questions, but you guys answered all of them within your discussion.
Perfect.
Well, I'm glad.
Yeah.
Byron is clairvoyant, so he can sense all of those questions, and that's why they've been answered.
Exactly. The one that I think has been answered in the past, but it would be good to kind of refresh it. If you received Moderna, can you receive the Pfizer booster?
That's a wonderful question.
That is absolutely a great question, and the answer is absolutely yes. If that's what you have available at the particular area that you're in, or depending on the storage facilities for some of these areas, they may have one vaccine versus the other because they got a shipment of this. Now, the important thing is getting that booster dose. The Pfizer booster and the Moderna booster are very similar in their dosage. They're more similar than the actual original treatments. But if you have received Pfizer in the past and you think, well, my clinic up the street or the pharmacy up the street has got all they've got is Moderna, you don't have to wait for them to get Pfizer. Absolutely. I myself got my booster, even though my original series was Pfizer, I got a Moderna booster. So in some ways, that may actually, kind of give you the best of both worlds. You've got both of those agents on board. So yes, you absolutely can. I encourage you to do so. If mixing and matching is what you think either would give you better protection or this is all that's available, absolutely. Go ahead and get that booster. The important thing is, particularly during this current time of surge, make sure you've got that booster on board and realize it still takes a couple of weeks before you start seeing good protective benefits. So you want to make sure that you get that and have it well on board before you start getting out and getting into any situation where you may be encountering COVID, for sure.
And it's my understanding for children under, or teens or children under 18, Pfizer is still the only recommended.
It is. If you are a child, anyone under the age of 18, still the protective dose for booster doses is currently still the Pfizer product. We anticipate that Moderna will follow suit at some point, but for right now, yes, that is the case. And so for anyone under 18, they would need to get the only product that is currently approved, and that is the Pfizer product. But still, again, very important that if you're not in that category, very important to go ahead and get the booster when you've reached at least the 5-month point or 6-month point from your original vaccination, or if you managed to get a J&J vaccine originally 2 months after the anticipated time, or you got that last dose, that's the anticipated time that you should start thinking about getting your regular boosters.
Wonderful. Well, thank you, Byron.
You're very welcome.
As always, appreciate you and all your knowledge.
Yes, sir.
I hope we don't have to do this again.
Maybe we won't.
Let's cross our fingers.
Yeah,
we can do one and we say, oh my God,
Yeah,
I can't believe
yes.
COVID is over.
Yeah, thank goodness. That would be a great one to
let's
do.
look forward to that.
Yeah, definitely so.
Sophia?
All right, well, thank you, gentlemen, for this information and insight, and thanks to everyone who watched and submitted any questions. Please check on our social media pages often, as resources on COVID-19 vaccines and testing are shared very frequently. This video will also be made available on our YouTube channel for future viewing. Have a great day and stay safe.